Describe the key nutritional differences in dietary requirements between an adult dog and a senior dog. Explain how these differences affect the formulation of feeding plans and any considerations for managing age-related conditions in senior dogs. Answer: as dogs age, their nutritional needs change due to changes in metabolism, organ function, and physical activity. Adult dogs typically have higher energy needs relative to their body weight compared to senior dogs. Senior dogs, however, have reduced calorie requirements as their metabolism slows. The formulation of feeding plans for senior dogs needs to focus on maintaining lean muscle mass and preventing obesity. Since senior dogs are more likely to suffer from conditions like osteoarthritis, kidney disease, and dental issues, their diet should include specific adjustments. For instance, senior diets often have lower fat content to help prevent obesity, which can strain joints and exacerbate arthritis. The protein content should be moderate to support muscle maintenance, with higher quality proteins used to ensure easy digestion and optimal nutrient absorption. Fiber content in senior dog food is also increased to support digestive health and prevent constipation, a common issue in older dogs. Joint health can be managed by including supplements like glucosamine and chondroitin to support cartilage and improve mobility. Omega-3 fatty acids, such as those from fish oil, help reduce inflammation, which is especially beneficial in dogs with arthritis. Additionally, antioxidants like vitamins C and E can help support immune function, which tends to decline with age. Identify and explain the ethical implications of withholding certain treatments from an animal patient due to the owner's inability to afford them. How should a veterinary nurse navigate this situation according to professional ethical guidelines? Answer: the ethical dilemma of withholding treatment from an animal due to financial constraints raises several concerns. Veterinary nurses must balance the animal's best interests with the owner's ability to provide care. The primary ethical principle at stake here is beneficence, acting in the best interest of the animal. Withholding treatment due to financial reasons could lead to unnecessary suffering or worsened health conditions, which would violate this principle. At the same time, veterinary nurses must respect client autonomy and financial limitations. It is crucial for nurses to communicate openly with pet owners, explaining the consequences of not following through with prescribed treatments. They should inform owners of all available treatment options, including low-cost alternatives that still provide some benefit and, where possible, offer payment plans. Providing a clear explanation of the cost-benefit analysis is key to helping owners make informed decisions. If an owner cannot afford the prescribed treatment, the nurse can discuss the possibility of seeking financial assistance from pet welfare organizations or charities which might provide funding for medical care. The nurse should also be mindful not to judge the owner for their financial situation, but instead offer empathetic guidance to ensure the animal's welfare is maximized. Emily, a veterinary nurse, is handling a case involving a cat named Bella who has chronic kidney disease (CKD). The veterinarian has prescribed a therapeutic renal diet, but Bella's owner is hesitant due to the higher cost. How should Emily address this situation to ensure Bella receives appropriate care, and what alternative options could she consider? Answer: in this scenario, Emily should first provide the owner with a thorough explanation of the benefits of the therapeutic renal diet. Renal diets are specifically formulated to reduce the workload on the kidneys by controlling protein levels, lowering phosphorus, and providing essential fatty acids to support kidney health. She should explain that while the cost of these diets may be higher, they can significantly improve Bella's quality of life by slowing the progression of CKD, potentially reducing the need for more costly treatments or emergency care in the future. If the owner remains concerned about the cost, Emily can offer practical solutions. She can discuss options such as purchasing the diet in bulk or finding a more affordable brand that still meets the dietary requirements for CKD management. If the veterinarian's prescribed food is not affordable, Emily can suggest transitioning to a more cost-effective option that provides similar benefits. Furthermore, Emily can inquire whether the owner has access to financial assistance programs or charitable organizations that help cover the cost of therapeutic pet diets. Finally, Emily should also recommend close monitoring of Bella's condition and regular follow-ups to assess how well the diet is working, ensuring the owner feels supported throughout the process. What are the legal and ethical responsibilities of a veterinary nurse when treating an animal with suspected neglect or abuse? What steps should be taken according to animal welfare legislation? Answer: veterinary nurses have both ethical and legal responsibilities when dealing with suspected animal abuse or neglect. Ethically, they are expected to act in the best interest of the animal and report any signs of abuse or neglect. Legally, in many jurisdictions, veterinarians and veterinary nurses are mandatory reporters, meaning they are legally required to report suspected animal cruelty to authorities. The first step is to observe and document any signs of neglect or abuse, such as malnutrition, untreated injuries, or signs of neglect in the animal's care. This documentation should be detailed and objective, noting the animal's condition without personal judgment. The next step is to inform the veterinarian in charge of the case, who will then decide whether to report the situation to the relevant authorities, such as animal welfare organizations or law enforcement. In cases where abuse is suspected, the nurse should not confront the owner directly, as this could escalate the situation. Instead, they should focus on protecting the animal and ensuring its safety. It is important to follow the clinic's protocols for reporting abuse, which may involve contacting local animal welfare organizations or other appropriate authorities. The nurse should also ensure that the animal receives immediate care and treatment to address any physical or psychological harm caused by the abuse or neglect. What are the primary factors that affect the digestibility of different nutrients in a therapeutic diet for a dog with gastrointestinal issues? Explain how these factors influence diet formulation. Answer: the digestibility of nutrients in a therapeutic diet for dogs with gastrointestinal issues is influenced by several factors: protein quality, fat sources, fiber content, and the inclusion of specific digestive aids such as probiotics and probiotics. Protein quality. High-quality, easily digestible proteins are essential for dogs with GI issues because they provide essential amino acids without overwhelming the digestive system. Fat sources. Fats are an important energy source but can be difficult to digest for dogs with GI issues. Therapeutic diets typically use medium-chain triglycerides (MCTs), which are easier to digest and absorb than long-chain fats. Fiber content. Fiber plays a key role in managing GI health, but the type and amount of fiber need to be adjusted based on the specific condition. Soluble fibers, such as those from oats or pumpkin, help absorb excess water in the intestines and can soothe inflammation in cases of diarrhea. Insoluble fibers can support bowel regularity, but too much can exacerbate symptoms in conditions like inflammatory bowel disease. Digestive aids. Probiotics and probiotics can help support the gut microbiome, aiding in digestion and nutrient absorption. Why is it important to monitor hydration levels in animals with chronic diseases such as kidney disease or diabetes, and what methods can a veterinary nurse use to assess hydration status? Answer: monitoring hydration is critical in animals with chronic diseases such as kidney disease or diabetes, because dehydration can exacerbate the progression of these conditions and lead to serious complications. For example, in kidney disease, dehydration can worsen kidney function, leading to increased toxin buildup in the bloodstream. Similarly, in diabetic animals, dehydration can increase the risk of hypoglycemia and lead to more severe symptoms such as lethargy and weight loss. Veterinary nurses can assess hydration status using several methods. Skin tenting. Gently pulling the skin at the back of the neck or between the shoulder blades. In well-hydrated animals, the skin will quickly return to its normal position. In dehydrated animals, the skin will remain tented for a longer period. Capillary refill tie (CRT). Pressing gently on the gums to blanch them, then observing how quickly the color returns. A delay in the return of color can indicate dehydration or poor circulation. Mucous membranes. Checking for dryness or tackiness of the gums and inside of the mouth, as these can be signs of dehydration. Urine output. Monitoring the volume and concentration of urine can also help determine hydration status. Dehydrated animals often produce smaller amounts of more concentrated urine. Weighing the animal. Regular weight checks can help track fluid loss or retention, aiding in the identification of subtle changes in hydration status. By accurately monitoring hydration, veterinary nurses can ensure that animals with chronic diseases receive appropriate fluid therapy, either orally or through intravenous or subcutaneous fluids, to maintain optimal health. What are the key considerations when handling a high-risk patient undergoing surgery, such as an animal with heart disease or obesity, and how should a veterinary nurse prepare for these patients? Answer: handling high-risk patients undergoing surgery requires careful consideration and preparation to minimize the risks of complications. Animals with heart disease, for example, may experience difficulty during anesthesia, making it essential to monitor heart function closely before, during, and after the procedure. For obese animals, the risk of anesthesia complications is also increased due to reduced lung capacity and altered drug metabolism. Key considerations for these patients include pre-surgical assessment. Veterinary nurses should ensure that all relevant diagnostic tests, such as blood work, electrocardiograms, or X-rays, are performed to assess the animal's overall health. These tests help identify any underlying conditions that may affect anesthesia or surgery. Anesthesia management. For heart disease patients, the anesthetic protocol should be tailored to minimize stress on the cardiovascular system. A veterinary nurse should work closely with the veterinarian to choose drugs that are safe for high-risk animals. Monitoring devices such as blood pressure cuffs, ECG, and pulse oximeters should be used during the surgery to monitor the patient's status. Weight management. In obese animals, the veterinary nurse should ensure that the animal is positioned appropriately on the operating table to avoid pressure on the chest and to facilitate breathing. Anesthesia drugs should be adjusted based on the animal's body mass to avoid oversedation or overdose. Post-operative care. High-risk patients require close monitoring in the recovery period. This includes monitoring vital signs, pain management, and ensuring that the animal remains stable as they regain consciousness. Overall, careful planning, monitoring, and collaboration between the veterinary team are essential when managing high-risk patients to ensure the best surgical outcomes. What are the benefits of using animal behavior modification techniques in managing anxiety in pets during veterinary visits, and what techniques can a veterinary nurse use to help reduce stress? Answer: Behavior modification techniques play a significant role in managing anxiety in pets during veterinary visits. Stress and anxiety can negatively affect the animal's health, both physically and emotionally. When animals are anxious or fearful, they may exhibit behaviors such as aggression, trembling, or hiding, which can complicate the examination or treatment process. By using behavior modification techniques, veterinary nurses can create a more positive and less stressful experience for both the pet and the owner. Techniques include positive reinforcement. Rewarding calm behavior with treats, praise, or affection helps the animal associate the veterinary visit with positive experiences. Over time, this can reduce anxiety and encourage more relaxed behavior. Desensitization. Gradually exposing the animal to veterinary procedures in a controlled and non-threatening manner can help them become accustomed to the experience. For example, nurses can introduce the animal to the examination room or scales without performing any invasive procedures at first. Counter-conditioning, pairing a feared situation like an injection with a pleasant experience, such as a favorite treat, can change the pet's emotional response to the situation. Calming aids, use of pheromone sprays, calming music, or anxiety wraps can help soothe pets during their visit. These non-invasive tools can create a more comfortable environment. By implementing these techniques, veterinary nurses help manage anxiety, improve patient cooperation, and enhance the overall experience of veterinary visits. This results in better outcomes for both the pet and the veterinary team. What are the primary steps in conducting a physical examination on a feline patient, and how can a veterinary nurse ensure the examination is thorough while minimizing stress for the cat? Answer: Conducting a physical examination on a feline patient involves a systematic approach to evaluate the cat's health while minimizing stress. Cats can be more sensitive to handling than dogs, so a calm environment and gentle handling are essential. Primary steps in a physical examination for a cat. Observation. Begin by observing the cat's behavior, posture, and respiratory rate from a distance. This allows for a more accurate assessment of the cat's normal demeanor and any signs of distress or discomfort. Head and neck. Examine the eyes, ears, nose, and mouth. Check for discharge, inflammation, or signs of dental disease. Gently inspect the ears for debris or infection and assess the eyes for clarity and signs of irritation. Thorax. Listen to the heart and lungs using a stethoscope, checking for any irregular heartbeats or abnormal lung sounds. Count the respiratory rate and check for any wheezing or coughing. Abdomen. Palpate the abdomen to check for masses, organ size, and areas of tenderness. This step requires gentle handling, as excessive pressure can be uncomfortable or painful for the cat. Abdomen. Palpate the abdomen to check for masses, organ size, and areas of tenderness. This step requires gentle handling, as excessive pressure can be uncomfortable or painful for the cat. Limbs and paws. Examine the cat's limbs for any swelling, pain, or abnormalities in movement. Check the paws and claws for signs of injury, matting, or infection. Skin and coat. Assess the quality of the coat and look for any signs of parasites, wounds, or dermatitis. Weigh and body condition. Weigh the cat and assess body condition to help monitor health over time, especially if the cat is on a weight management plan. Minimizing stress. Approach the cat slowly, speaking in a calm voice. Use towels or blankets to gently wrap the cat if needed, providing a secure and comforting hold. Limit handling time to avoid overstressing the cat and allow rest periods if the examination is prolonged. Explain the importance of zoonotic disease awareness in veterinary practice and list 3 common zoonotic diseases that veterinary nurses should be able to recognize. Answer: Zoonotic disease awareness is crucial in veterinary practice. to protect both veterinary staff and clients from infections that can be transmitted between animals and humans. Recognizing zoonotic diseases helps veterinary nurses take appropriate precautions to prevent the spread of these diseases, which can be transmitted through direct contact, bites, scratches, or environmental contamination. 3 common zoonotic diseases: rabies, a viral disease that affects the nervous system of mammals, including humans. It is transmitted through bites or saliva exposure from infected animals, primarily wildlife such as bats, raccoons, and foxes. Veterinary nurses should recognize signs of aggression, disorientation, and paralysis in animals that may indicate rabies. Ringworm, a fungal infection that affects the skin, hair, and nails of animals and humans. It is highly contagious and can be spread by direct contact with an infected animal or contaminated surfaces. Symptoms in animals include hair loss and scaly patches, while humans may experience itchy, red ring-shaped lesions on the skin. Leptospirosis, a bacterial infection transmitted through the urine of infected animals, such as rats or dogs. Humans can become infected through contact with contaminated water, soil, or animal urine. Symptoms in animals include fever, vomiting, and lethargy, while in humans it can cause flu-like symptoms and, in severe cases, liver or kidney damage. To prevent zoonotic disease transmission, veterinary nurses should use personal protective equipment, maintain rigorous hygiene practices, and educate clients on zoonotic risks associated with their pets. When performing radiography on a canine patient, what specific techniques and safety measures should be in place to minimize radiation exposure to both the patient and staff? Include specific guidelines on positioning, shielding, and personal protective equipment (PPE). Answer: when conducting radiography, minimizing radiation exposure is critical for both the patient and veterinary team. Radiation safety principles in veterinary radiology align with the ALAI as low as reasonably achievable concept for positioning and restraint. Using positioning aids like sandbags, troughs, or foam pads is advised to avoid direct human contact. Non-manual restraint is preferred, but if manual restraint is necessary, it should be conducted by trained staff equipped with personal protective equipment (PPE). Shielding plays a vital role in radiation safety. Staff should wear lead aprons, gloves, and thyroid collars to protect against scatter radiation, which is common in X-ray settings. These lead-based PPE items are effective barriers against radiation. The principle of the inverse square law states that radiation exposure decreases with the square of the distance from the source. So doubling the distance from the X-ray source can reduce exposure significantly. To meet regulatory standards like those outlined in the Ionizing Radiations Regulations 2017 in the UK, regular equipment maintenance monitoring of exposure (e.g. with dosimeter badges and appropriate record keeping are required. Dosimetry reports help track cumulative exposure and ensure that no individual exceeds safe limits. Dr. Nguyen is preparing a hematology sample for a canine patient with suspected anemia. The sample will be sent to an external laboratory for a complete blood count, CBC, and reticulocyte count. Midway through sample preparation, Dr. Nguyen notices that the DTA tube is only half full due to a challenging blood draw. What impact might this have on the results, and what should Dr. Nguyen do to ensure accurate analysis? Answer: for hematology testing, particularly a CBC and reticulocyte count, fill in the DTA tube to the appropriate level is essential. DTA tubes are designed to contain a specific volume of blood. To anticoagulant ratio underfilling can lead to excessive DTA, which may cause cellular distortion and hemolysis cell damage. This issue can affect red blood cell morphology, potentially leading to errors in diagnosing anemia. Additionally, underfilling impacts cell counts by creating an incorrect dilution, thus skewing results like hemoglobin concentration and red cell indices. In Dr. Nguyen's case, the best course of action would be to attempt a new blood draw to ensure a properly filled DTA tube. If this is not feasible, Dr. Nguyen should label the tube indicating it is underfilled and inform the laboratory. This allows the lab to factor in the altered blood to anticoagulant ratio during analysis. If recollection is impossible, conducting a microscopic blood smear may provide additional diagnostic insights into the presence of reticulocytes and red cell morphology, supplementing the CBC results, ensuring proper sample collection, and communicating any deviations in sample integrity with the lab are critical steps in achieving reliable diagnostic outcomes. Describe the primary benefits of ultrasound imaging over radiography when examining soft tissues in veterinary patients. Why might ultrasound be the preferred diagnostic tool in cases of suspected abdominal pathology? Answer: ultrasound is particularly advantageous for evaluating soft tissues due to its superior soft tissue contrast, real-time imaging capabilities, and absence of ionizing radiation. These characteristics make it preferable to radiography in assessing soft tissue structures, especially within the abdominal cavity. Unlike radiographs, which provide two-dimensional static images and limited detail on soft tissue, ultrasound produces high-resolution, cross-sectional images that can reveal abnormalities in tissue structure. In cases of suspected abdominal pathology, ultrasound allows for dynamic assessment of organs such as the liver, spleen, kidneys, and intestines. By utilizing Doppler ultrasound, the flow of blood through vessels can also be observed, providing insights into vascular health. Additionally, ultrasound is safer for repeat examinations because it uses sound waves rather than radiation, which is especially beneficial for young animals, pregnant patients, or those needing ongoing monitoring. The modality's ability to provide real-time information aids in procedures like guided biopsies or fluid aspirations, improving diagnostic accuracy without additional radiation exposure. In cytological analysis, why is it crucial to create multiple thin smears of collected samples, and what factors might lead to non-diagnostic samples? Answer: in cytology, creating multiple thin smears allows cells to spread out in a single layer, enabling detailed morphological assessment without cell overlap. Thin smears help pathologists identify individual cell characteristics, such as shape, size, and nuclear features, which are critical in differentiating benign from malignant processes. Additionally, spreading the sample evenly reduces the chance of clumping, which can obscure cells and hinder accurate evaluation. Factors contributing to non-diagnostic samples include improper collection techniques, such as using contaminated instruments or collecting insufficient material. Poor sample handling, like rough smearing or inadequate staining, can damage cells or obscure diagnostic features. Delayed sample preparation may also result in cellular degeneration, as cells may start to break down outside the body, creating artifacts that can complicate interpretation. By preparing multiple thin smears, sample quality is enhanced, allowing for a more thorough assessment and decreasing the likelihood of needing repeat sampling, which can be invasive or stressful for the patient. Dr. Patel is using an ultrasound machine to diagnose a suspected case of liver disease in a feline patient. During the procedure, she realizes the machine is not calibrated and image quality is poor, making it difficult to interpret results. What steps should Dr. Patel take to troubleshoot and resolve this issue effectively? Answer: Dr. Patel should first check the ultrasound machine settings, focusing on parameters like gain, depth, and frequency to ensure they are appropriate for abdominal imaging in a feline patient. Adjusting the gain will help optimize brightness and contrast, while depth should be set to visualize the entire liver. If image clarity remains poor, probe selection and contact gel application should be verified, and the probe must be suitable for small animal abdominal imaging, typically with higher frequencies for better resolution in smaller patients. If adjustments don't improve quality, Dr. Patel should consider equipment calibration. Regular calibration, as advised by manufacturers, is crucial to maintaining image quality, and neglecting it can lead to diagnostic inaccuracies. Documenting and scheduling routine equipment maintenance, including cleaning and probe inspection, will prevent similar issues in the future. Taking these steps allows Dr. Patel to obtain clear images essential for assessing liver structure, identifying lesions, and making an accurate diagnosis, which is vital for patient care. When performing urinalysis, what steps should be taken to ensure that the sample provides accurate results, and why is immediate analysis critical in certain tests? Answer: urinalysis is time-sensitive. A components such as cells, casts, and crystals can degrade if not analyzed quickly, potentially skewing diagnostic results. Immediate analysis allows for an accurate assessment of urine chemistry and microscopic elements like epithelial cells, white blood cells, and bacteria, which are essential for diagnosing infections or renal disorders. Sample storage is crucial if immediate analysis is not possible. Refrigerating the sample helps slow bacterial growth and stabilizes certain chemicals, but may cause crystal precipitation, which can complicate microscopic examination. Allowing refrigerated samples to return to room temperature before analysis minimizes temperature-related artifacts. Additionally, proper sample collection and handling prevent contamination, which could lead to false positive results for bacterial presence or skew pH readings. Immediate testing also helps prevent the breakdown of substances like bilirubin and glucose, as exposure to light or changes in temperature can lead to false low readings, particularly relevant for diabetic patients. By following these protocols, the urinalysis will yield reliable data critical for diagnosing conditions such as urinary tract infections or kidney disease. Explain how stress-induced hypoglycemia might impact blood glucose readings in feline patients, and how should the veterinary team account for this in diagnostic procedures? Answer: feline patients are prone to stress-induced hypoglycemia due to the release of catecholamines, e.g. adrenaline, during clinical visits. This physiological response can elevate blood glucose levels, potentially leading to a false positive indication of hypoglycemia or even diabetes if not accurately interpreted. To manage this, the veterinary team can use alternative methods such as at-home testing or continuous glucose monitors to measure glucose levels in a less stressful environment. Additionally, the fructosamine test may be used to assess average blood glucose over a 2-week period, helping to distinguish stress-induced hypoglycemia from chronic hypoglycemia associated with diabetes. In clinical settings, it is essential to minimize stresses by using quiet examination rooms and gentle handling techniques, which can lower stress-related glucose spikes. By considering the impact of stress, the veterinary team can ensure that blood glucose readings more accurately reflect the patient's true metabolic status. Describe the importance of handling and processing blood samples correctly for biochemistry testing, particularly focusing on factors that can lead to hemolysis. How does hemolysis impact test results, and what practices help prevent it? Answer: proper handling and processing of blood samples are essential for reliable biochemistry results, as hemolysis, the rupture of red blood cells, can significantly alter test outcomes. Hemolysis releases intracellular components like hemoglobin, potassium, and certain enzymes into the plasma or serum, which can falsely elevate levels in biochemistry tests and interfere with analyte measurements. To minimize hemolysis, blood should be drawn using appropriate needle sizes, as too small a needle can shear cells during collection. It's also crucial to avoid excessive force when transferring blood into collection tubes, as well as vigorous shaking, which can rupture cells. Using serum-separated tubes can help by isolating the serum after centrifugation, reducing the likelihood of further cell breakdown. Immediate and careful processing is recommended. Samples should ideally be centrifuged as soon as they clot, and plasma or serum should be separated from cells to prevent any artifacts from cellular degradation. These handling practices help ensure accurate results, which are vital for appropriate clinical decision-making in conditions where biochemistry markers guide diagnosis and treatment, such as renal or liver disease. Why is it important to submit histopathology samples with clear margins, and how should these samples be processed to ensure accurate diagnostic results? Explain the importance of fixation in histopathology. Answer: omitting histopathology samples with clear margins is critical in determining the extent of a lesion or tumor. Margins refer to the borders of the tissue sample around the abnormal growth. The clear margins indicate there are no cancerous cells at the edges, suggesting the tumor was entirely removed. This is especially significant in oncology cases, where margin status often guides further treatment options and prognosis. To ensure accurate histopathology results, samples should be properly collected, labeled, and fixed. Fixation is the process of preserving tissue integrity, typically using formalin, which prevents decomposition and maintains cellular structures for microscopic analysis. Proper fixation requires a 10:1 ratio of formalin to tissue to ensure adequate penetration, particularly for larger samples. Specimens should be placed in fixative immediately after excision to prevent cellular degradation, and samples should be appropriately oriented and marked e.g. with ink or sutures to identify margins clearly. Clear margins combined with effective fixation allow pathologists to assess whether surgical removal was complete. Inadequate fixation or poorly marked samples may lead to non-diagnostic results, potentially requiring rebiopsy. Ms. Thompson is examining a dog presenting with signs of weight loss, intermittent diarrhea, and a dull coat. She suspects a gastrointestinal parasite infection. Based on the clinical presentation, what types of diagnostic tests should Ms. Thompson consider, and why might multiple testing methods be needed? Answer: given the clinical signs, Ms. Thompson should consider fecal flotation and direct smear tests to detect the presence of gastrointestinal parasites. Fecal flotation is a common diagnostic test that identifies eggs or cysts of parasites such as roundworms, hookworms, and Giardia. This test involves mixing a stool sample with a solution that causes parasite eggs to float to the surface, where they can be examined microscopically. However, direct fecal smears are also beneficial, especially for protozoan infections like Giardia, which can sometimes be missed in flotation tests. Direct smears allow for the observation of motile protozoa, which are more visible immediately after sample collection. Given the variability in shedding of certain parasites, GERD assists conducting multiple tests on samples from different days, increases diagnostic accuracy. In cases where fecal results are inconclusive but clinical suspicion remains high, antigen detection tests or PCR polymerase chain reaction testing may be warranted. These tests are more sensitive and specific, helping detect low parasite loads or chronic infections. Utilizing a combination of these methods provides a comprehensive evaluation, ensuring an accurate diagnosis and appropriate treatment plan for the patient. What is the primary purpose of triage in emergency veterinary nursing, and how does it affect the prioritization of care for critically ill animals? Answer: triage is a critical process in emergency veterinary nursing where the healthcare team assesses animals upon arrival to determine the urgency of their condition and prioritize care based on the severity of their injuries or illness. The primary goal of triage is to provide rapid and appropriate care, ensuring that animals with life-threatening conditions receive immediate attention while less critical cases are managed afterward. In emergency care, a common guideline is the ABCDE approach: airway management, ensuring clear airways, breathing, assessing respiratory function, circulation, checking pulse and blood pressure, disability, neurological status, exposure assessment for environmental factors or additional injuries. The triage system allows veterinary professionals to make decisions about which patients need life-saving interventions first and which can safely wait. The priority is always to stabilize critical cases like severe trauma, shock, or respiratory distress. Explain the rationale for using oxygen therapy in resuscitation and the potential risks associated with its improper administration in small animals. Answer: oxygen therapy is an essential part of resuscitation, particularly in cases where animals exhibit hypoxia or respiratory failure. The rationale behind its use lies in providing adequate oxygen levels to tissues and organs, which is crucial for cellular function and metabolic processes. Oxygen therapy can improve tissue oxygenation, stabilize vital organ function, and prevent irreversible damage during critical periods. In small animals, however, improper administration of oxygen can pose significant risks. Over-oxygenation, particularly in species like dogs and cats, can lead to oxygen toxicity, causing damage to lung tissue, resulting in conditions like pulmonary edema or bronchoconstriction. Additionally, using high-flow oxygen in small animals without proper monitoring may lead to hypercapnia, elevated carbon dioxide levels, which can worsen respiratory distress in certain cases. The American College of Veterinary Emergency and Critical Care (ACVEC) guidelines stress the importance of individualized oxygen administration protocols, ensuring oxygen levels are carefully monitored using pulse oximeters and blood gas analysis. Furthermore, the amount of oxygen delivered should be adjusted based on the animal's response and clinical condition. Mr. Thompson arrives at your veterinary clinic with his pet parrot, Charlie, who has been found unresponsive after an apparent fall from a significant height. Upon arrival, Charlie is lethargic, showing signs of respiratory distress, and has a slight wing fracture. What immediate actions should Mr. Thompson take upon your recommendation, and how would you proceed with Charlie's care? Answer: upon arrival, Mr. Thompson should immediately follow instructions to prevent further injury to Charlie, as the bird is unresponsive and exhibiting signs of respiratory distress. The following steps should be taken. Immediate stabilization. The bird should be placed in a secure and quiet environment to minimize stress. Due to Charlie's respiratory distress, administering supplemental oxygen via an appropriate mask or oxygen cage is essential to stabilize oxygen levels. Triage. Following the triage approach, assess Charlie's airway, breathing, and circulation. Since Charlie shows respiratory distress, oxygen therapy should be prioritized. Stabilization is essential before addressing the wing fracture. Injury management. The fractured wing should be gently immobilized using a soft splint or bandage to prevent further damage. Monitoring vital signs, including heart rate, respiratory rate, and temperature, is critical. Ongoing monitoring. Continuous monitoring using a pulse oximeter is necessary to assess oxygenation and respiratory function. Administer fluids if signs of shock are present. Veterinary consultation. Following stabilization, Mr. Thompson should be referred to a veterinarian for detailed diagnostics, including radiographs, to assess the extent of the injury and any potential internal trauma. What specific considerations must be made when administering emergency drugs to exotic animals, and why are dosage calculations particularly critical in these cases? Answer: emergency drug administration to exotic animals requires careful consideration due to the diverse species-specific physiology, varying drug metabolism, and potential for unique responses to medications. Factors that influence drug administration in exotics include species variability. Different species may metabolize drugs differently. For example, reptiles have slower metabolisms than mammals, which can affect how long drugs stay in their system. Body size and weight. Exotic animals often have smaller or more variable body sizes, meaning drug dosages must be calculated based on exact weight and species. Drug sensitivities. Exotic species may have heightened sensitivities to certain medications. For example, some birds are particularly sensitive to NSAIDs, which can cause kidney failure even at therapeutic doses. Dosage calculations are critical in these cases because overdosing or underdosing can have severe consequences. To calculate dosages accurately, veterinary professionals use weight-based dosing, often converting dosages from standard mammalian protocols to species-specific needs. Explain the significance of critical care monitoring in veterinary nursing and describe the key parameters that must be continuously monitored in a critically ill animal. Answer. Critical care monitoring is essential for ensuring the stability of critically ill animals and guiding appropriate interventions. The primary objective is to detect early signs of deterioration and provide real-time feedback on the animal's response to treatment. Key parameters that must be continuously monitored in a critically ill animal include heart rate and rhythm. Tachycardia, bradycardia, and arrhythmias can indicate problems such as shock, heart failure, or electrolyte imbalances. Respiratory rate and effort. Monitoring respiration is critical in detecting hypoventilation, hyperventilation, or respiratory failure, particularly in animals with lung disease, trauma, or neurological conditions. Blood pressure, hypotension, or hypertension can reflect issues with cardiovascular function, fluid balance, or systemic disease. Oxygen saturation. Pulse oximetry helps ensure adequate oxygenation, particularly in animals with respiratory or circulatory failure. Temperature, hypothermia or hypothermia may indicate systemic issues such as sepsis or heat stroke. How would you approach the resuscitation of a small mammal that has been found unresponsive following suspected cardiac arrest, and what are the critical differences in resuscitation techniques compared to larger animals? Answer. Resuscitation of small mammals, such as rabbits or guinea pigs, involves techniques tailored to their smaller size and unique physiological characteristics. The approach generally includes the following steps. Basic life support (BLS). Begin with chest compressions using fingers or a thumb in a gentle but firm manner to maintain blood circulation. Small animals require higher compression rates, approximately 150-200 compressions per minute, to maintain adequate circulation. Ventilation. For small mammals, mouth-to-nose resuscitation may be necessary if no mechanical ventilation equipment is available. This requires a very gentle air push to avoid causing injury to the lungs. Drug administration. Adrenaline epinephrine may be administered at a much lower dose compared to larger animals, as small mammals metabolize drugs more rapidly. Temperature regulation. Hypothermia is a risk in small animals during resuscitation, so maintaining body temperature through warm blankets or heating pads is essential. The key difference in resuscitation compared to larger animals lies in the techniques for compression, ventilation, and drug administration. Small mammals require more delicate handling to avoid causing injury during resuscitation. In critical care, what role does supportive therapy play, and what are the primary therapies used to support organ function in an animal suffering from septic shock? Answer. Supportive therapy in critical care aims to stabilize organ function and improve the animal's chances of recovery by addressing systemic issues such as shock, dehydration, and organ failure. In septic shock, the primary therapies focus on correcting fluid imbalances, managing infection, and supporting affected organs. Fluid therapy. This is critical for restoring blood volume and improving perfusion to vital organs. Crystalloids, e.g. saline, or colloids, e.g. hetastarch, are often administered to correct hypovolemia and improve circulation. Antibiotics. Broad-spectrum antibiotics should be administered as soon as sepsis is suspected, targeting the underlying infection causing the systemic inflammatory response. Vasopressors. Drugs such as dopamine or norepinephrine are used to increase blood pressure and improve blood flow to vital organs. Organ support. In cases of renal failure, renal replacement therapies like hemodialysis or peritoneal dialysis may be required to manage toxins and fluid overload. What is the role of the veterinary nurse in the management of wildlife injuries, and how do ethical considerations impact treatment decisions? Answer. The veterinary nurse plays a crucial role in stabilizing and managing wildlife injuries, including performing triage, providing supportive care, and assisting in diagnostic procedures. Wildlife care requires sensitivity to the animal's species-specific needs, including appropriate handling and restraint to minimize stress. Ethical considerations significantly impact treatment decisions. For example, when dealing with an injured wildlife species, a veterinarian and a veterinary nurse must evaluate whether the animal's injuries are treatable and whether its release into the wild is possible. If the injuries are severe and the prognosis poor, the ethical decision may lean toward humane euthanasia rather than prolonged suffering. In cases of conservation significance, the decision may also involve consultation with conservation bodies to determine the best course of action. Describe how the principles of pain management are applied in exotic animal care, particularly with respect to species-specific medications and dosages. Answer: pain management in exotic animals requires an understanding of the unique physiological characteristics and pain responses of each species. The principles of pain management in exotics typically involve species-specific medications. Certain drugs, such as opioids and NSAIDs, are dosed according to the animal's metabolic rate, with particular attention to species sensitivities. For example, some reptiles metabolize opioids more slowly than mammals, necessitating careful dosage adjustments. Non-pharmacological techniques. In addition to pharmacological pain relief, techniques such as heat therapy, gentle handling, and environmental enrichment may help reduce stress and alleviate pain. Multimodal pain management, combining medications, e.g., opioids for severe pain, NSAIDs for inflammation, with other therapies ensures comprehensive pain management. This approach is particularly important in species with complex pain responses like birds, where systemic opioids may not always be appropriate. What are the key challenges in caring for critically ill exotic animals, and how can nursing teams mitigate risks associated with improper handling and care? Answer: caring for critically ill exotic animals presents unique challenges, including their species-specific needs, physiological differences, and stress sensitivity. Key challenges include stress and handling sensitivity. Many exotic species, especially reptiles and birds, are highly sensitive to stress, which can exacerbate their condition. Stress can be minimized by using proper restraint techniques and maintaining a calm environment. Species-specific metabolism. Exotic animals often have metabolic rates different from mammals, requiring adjustments in drug dosages, fluid therapy, and feeding protocols. Diagnostic difficulties. Due to the rarity or novelty of certain species, diagnostic procedures may be less established, making it challenging to monitor their condition effectively. To mitigate risks, nursing teams should receive species-specific training, use appropriate handling techniques, and monitor vital signs frequently. Collaboration with experienced veterinarians in the care of exotic species ensures comprehensive treatment plans.